We have a number of patients on the renal transplant list. These are patients who are on dialysis whose kidneys aren't working, and if they're well enough and work out, they have the opportunity to have a kidney transplant, and one of our patients was lucky enough to get allocated a kidney, and they had a successful transplant a few months ago now, doing very well. So it's the first cadaveric transplant we've had for about 15 years. We did have some done before that in Spain. We've also had some what we call live transplants where patients donate to a relative, but this is the first one for about 15 years where a patient's passed away, donated a kidney, and one of our patients has been allocated it. So good news for Gibraltar.
And how many people are on the list at the moment?
So at the moment we have currently active, we have 6 patients on the UK renal transplant list, and we're in the process of working up a few more.
Dialysis is something that happens locally. For transplantation, we have to go to the UK or Spain. How does that work?
Yeah, so basically if your kidneys don't work, obviously you need dialysis. That's the only option we've got here in Gibraltar, and they have to come for treatment 3 times a week, typically about 4 hours, so it's quite an undertaking for the patients. But for those that are well enough and medically able to have it, we like to offer a transplant, and what happens is they go on, get worked up to make sure they're fit enough to have the transplant and the surgery involved and the drugs involved. And if their kidney becomes available, they get allocated, they get a phone call, can be any time of day or night, and then we've got a very narrow window to get the patient over to the transplant ward. The sort of thing we've negotiated at the moment is 12 hours, so from us getting the phone call to our patient being on the transplant ward in London, we've got 12 hours, so we've got a pretty sort of robust set of protocols and things with sponsored patients in order to try and get these patients over, because obviously this call comes at 3 in the morning, you've got to get somebody over to London sharpish. Yeah.
So the sponsored patient department are obviously playing a very vital role in this.
Yeah, absolutely key, and they've been fantastic. I mean, as evidenced in this case, we actually got our patient from Gibraltar to the transplant ward before the kidney arrived, so we couldn't have done better really. I think it was really good because it was the first one for us in such a long time, particularly with the Hammersmith Hospital. I was really keen it went well, and we came out looking good, as I think we are, and that's exactly what happened.